So when we're doing cars, when we do any car in the gym, you see people rotating their joints, trying to create joint independent movement, right? And so the point of us having like a pole, say, to fix ourselves against is we're trying to isolate your femur relative to, say, like the pelvis hiking, where as you come back, you're gonna feel your spine extending. And so the idea is that we're trying to create joint independence so that we have better interdependence when we're doing like weight training and stuff. And so when someone says like, oh, they feel their back when they're squatting, they feel their back when they're deadlifting, they don't feel their hips and their glutes working, they generally lack hip capsule function. And so the car pretty much showcases what does your hip do, and then it trains the current range of motion through that, right? Depending on how well your car works and how smooth it is, depending on how your car looks will dictate what other positional stretches we give you. And so like, for example, if you're here and you can only go up to here, you don't have that much external rotation, then we have a whole process to pretty much open up ER so that you have more range of motion in your car. Let's say you come out here and then you have a hard time internally rotating. Then we'll give you a stretch for internal rotation to be able to have more range of motion there. Let's say you come back here and you don't feel your butt engaging and you feel your lower back. You don't have hip extension. So the car is an assessment. It kind of showcases what can your hip do. You training the current range of motion. And then we also use it as a lose it or use it tool. Being that, like, you know the whole saying, if you don't use it, you lose it. Your car is your way of maintaining range of motion. And so pretty much all of the older folks should be doing cars so they don't get any worse. People like our age group usually needs to be doing cars so that we never lose it to begin with. Does that make sense? So you're gonna hold the pole. The pole is there to keep your hip pivoted. Yes, keep the hip glued to the pole. You're gonna start with your left leg and you're gonna externally rotate. So I want you to think, how far can I get my ankle relative to my knee? And when you're doing it, I want you feeling maybe your inner thigh, maybe your outer hip. You're gonna stay externally rotated and bring your knee out to the side, but don't let your torso move at all. And you're gonna feel a block like right about there, right? Yeah. Now without moving anything, don't let this come up, don't let this move. I want you to think about swiveling your femur like this and internally rotate, but don't let this hike up. Yeah, keep internally rotating and then bring your knee under you into hip extension. You feel your butt there? Okay. A little bit? I feel it on my lower back. You feel it in your lower back, right? So as you came around, you did this. Okay, so what I want you to do is pull your ribs down. You're gonna stay in that position. You're gonna go back. Do you feel your butt squeeze, your hamstring squeeze? So that's hip extension. You're gonna go out to your side. You feel your hip there. That's abduction. And then I want you to externally rotate without letting your spine extend, right? So keep the ribs down. Really think about this pulling towards me a little bit more. And then bring it all the way around. So that was one rep. Okay, it's pretty hard, right? It's harder than it looks. And so that's kind of the point, is that if you feel like you don't own a certain portion, like you said, as you came around, you felt your low back. I want you to try it again and see if can you find hip extension without feeling spine extension, right? And if you still can't do it, no matter how much I cue you, then you simply don't own it. And we need to create more range of motion so that your car is bigger and better, basically, okay? So let's try that again. So same thing, you're gonna go into external rotation, go up as high as you can, keep the ribs down. You're gonna go out to your side slowly until you feel that block right about there. Don't move a thing, keep the ribs down. Internally rotate. Watch the spine, ribs down, like I'm punching you. Slowly internally rotate. You feel a little crampy there at all? Okay, good. And now in reverse, knee forward and then back behind you. So we come forward and then back in reverse. Do you feel your butt squeeze there? Here. Okay, you found your glute, okay, that's hip extension. Now bring the knee out to me. You feel abduction, right? Watch the ribs. And then once you feel the end of abduction, start externally rotating. So rotate away from your body, yep. Keep going, ankle in more, ankle higher than knee. Keep going, all the way around to the front. That's rep number 2. Let's do one more, and then we can switch sides, okay? So external rotation, flexion. You feel that end point. You're gonna slowly rotate all the way out until you feel the block. Right about there. Keep the ribs down. Start internally rotating until you get underneath. Feel your glute. Keep the knee under you. Yep, and then reverse. Foot back. You feel the butt squeeze. Now bring the knee out to me, but watch the spine. Keep the ribs down. You feel the glute there. Okay, you found that end point. Now externally rotate. And then bring it all the way around. Does that make sense? Yeah. And so it's one of those things that when people are doing their cars, let's have you flip around to the other side. People are doing their cars, they'll like sit there and try to go all the way around as far as they can. And then their spine and pelvis are kind of convoluted in with their hip. It's probably better than them doing nothing, but the car is like the anti-compensation tool. So we found out that hip extension's a little hard for you to find, but once you focus, you can find it. If this leg's any different, then that leg might have different needs and would be trained differently than your left leg. And if you have injury history, that might reflect it as well. Same thing, opposing leg, you're gonna externally rotate. You feel inner thigh, you feel some outer glute, bring it all the way out. You feel that end point like right about there. That's your cue. You ran out of range, start internally rotating. Watch the spine. Yep, you see how your spine wants to extend real bad, right?
Yeah.
Good. Keep going under, keep going under, keep going under to about there. And now you're gonna come up a little bit and then reverse, go behind you. Do you feel your butt squeeze there? Okay, you found hip extension. Now bring it out to me, your knee, into abduction. You feel the hip there, the glute. And then you're gonna externally rotate and swivel your femur and keep thinking ankle higher than knee, just try. And then bring it all the way around. Does that feel different than the other side?
Yeah,
a little bit, right? And you'll find that sometimes your dominant side's better than your non-dominant. You might find that the hip that is worse actually has an ankle that's worse too. You might find that like people who squat would be like, oh, I might have SI joint pain. They might feel their low back on one side. That hip probably doesn't work as well. And so the car is an assessment tool in that sense too. But you could see where as soon as we isolate your hip, all these other compensations jump into it.
Yeah.
And so the idea is that this is considered internal training so that when you do external training like squatting, things just kind of click better. Let's do 2 more and then we'll go ahead and move on from that. So external rotation, bring it all the way out to me. Do not rotate towards me at all. Yep. You feel that end point? Now without hiking anything up, start internally rotating. Knee back as you do that, knee back, knee back. Beautiful. You feel your glute in reverse and hip extension, right? Bring it out to me, the knee. You feel the glute contract right there. That's your end point. If it's a little crampy there, take a big deep breath. Try to get comfortable there. Once you have that end point, externally rotate and keep swiveling that as much as you can. Bring the ankle in, all the way around. All right, 1 more, all the way up. You found that end point. Does this side feel better here than the other side does?
Yeah.
You have more external rotation on your right. So if we're looking at like your assessment, your left side needs ER relative to your right side. And that's how we kind of narrow down what hip has a weak spot, what hip doesn't. So just stuff to think about as we do this, right?
It moves a lot better than the left one.
All right, bring it all the way up, all the way around. Generally, I start on the bad side too to kind of give it the attention it needs. Keep the ribs down, tight, tight, yep. Slowly internally rotate. Beautiful, you feel the glute there. You can go back in reverse. You feel the glute in abduction, big deep breath there. Own that range. If you're cramping, own it. Watch the spine, and then externally rotate. And then bring that all the way around. I want you to do 1 more, but do not push into my pen. So you start to, when you do it, you tend to rotate a little bit.
Yeah.
I'm gonna put my pen here as another block, and I want you to do the same thing and just feel the difference when I isolate you more, okay? So starting position, ER. You're gonna bring it all the way out to me. That's about it right there. Now slowly internally rotate. Slow, more internal. Beautiful, reverse. You feel the glute there. Bring it out to me. Watch the spine. Right there, externally rotate. It's a lot harder than it looks, isn't it?
Yeah.